5 quick facts about Medicare. So let's get right into it. Medicare has 4 parts: Part A, Part B, Part C, Part D. I can't tell you why they break it down into pieces, but they do. So Part A only covers the room and board when you're admitted into a hospital. So a semi-private room, your meals, things of that nature are covered under Medicare Part A. Medicare Part B covers pretty much everything else. So it covers doctor's visits, specialist visits, outpatient stuff, anything that's really outside of that room and board in the hospital. So all the medical stuff that happens in the hospital is also covered under Medicare Part B. A lot of people don't quite understand that, but it is broken down into those different pieces. Medicare Part C really shouldn't be a part of Medicare because it's actually not Medicare, it's Medicare Advantage. I'm not sure why they would put it as Medicare Part C, but it is Medicare Advantage, which actually takes you off of Medicare and puts you into a plan run by a private insurance company. Likely all the TV commercials that you see right now are about Medicare Advantage plans. So it does take you away from original Medicare, put you into a network-based plan. So you have a network of doctors, hospitals, things of that nature. It works completely different than original Medicare. I have videos on all that. You want to make sure you understand the difference between original Medicare with a supplement plan and a Medicare Advantage plan, because that is going to be your main decision when you come into Medicare, is which one of those 2 avenues are you going to take, Medicare Advantage or stay with original Medicare with a Medicare supplement plan. I certainly have a strong opinion on this. I would always stay with original Medicare, but you need to make sure you understand how they work so you can make that right decision. The last piece is Medicare Part D, which is a Medicare drug plan. So Medicare drug plan would go along if you're going to stay with original Medicare. Most Medicare Advantage plans kind of bundle it up and include a Medicare drug plan in their program. So it's important to understand that too, because drug plans are completely different and they're really based for you on your current medications. That's how you choose which one you're going to take, how they cover what you currently take, because they may not cover as well if your medications change in the middle of the year. You may need to change later with a Medicare drug plan. So that's our first fact. The 4 parts, A, B, C, and D, covers Medicare in their different pieces. Second quick fact, Medicare is not free. A lot of people think when they get to Medicare, it's going to be free. It is absolutely not free. There are costs that you need to understand so you don't get hit by surprises. Now, first off, under Medicare Part A, it is free as long as you have worked for 40 quarters during your lifetime. So 10 years, if you paid into Medicare, there is no cost to Medicare Part A. If you have not worked your 40 quarters, there is a premium. So if you've only worked 30 to 39 quarters, that premium is $258 a month. If you've worked less than 30 quarters, that premium goes all the way up to $518 a month. So it's important to know that, because that could be a big surprise if you want to come into Medicare and all of a sudden you have to pay for your Medicare Part A. It can be a significant out-of-pocket expense. And then we have Medicare Part B. Medicare Part B, the stuff that happens outside the room and board, does have a premium. And that premium right now is about $185 a month. And what's important to understand about this, that Medicare Part B premium, is it is income adjusted. So that $185 is the lowest, the base premium for Medicare Part B. Most people will pay that $185. However, it is income adjusted. I have a video specifically, I probably have a couple videos specifically on this. You need to make sure you understand that if you're going to have income after you're in Medicare, maybe you're self-employed, investments, withdrawals, all sorts of things can count as income, but that $185 can go all the way up to more than $600 a month depending upon your income. So make sure you look for my video. It's called IRMA. It's Income Related Monthly Adjustment Amount, and it can raise that Medicare Part B premium significantly if you do have income coming after you're already into Medicare. Now on the out-of-pocket expense side, so Part A has a deductible if you are admitted into the hospital, and it's about $1,600 a month, so it can be significant. However, if you're going to stay with original Medicare Part A and Part B, which I absolutely recommend, you'll likely have a Medicare supplement plan. That Medicare supplement plan is going to cover that Part A deductible, so then there really is not going to be a deductible if you're admitted into the hospital. Now your Medicare Part B, all your regular medical stuff, doctors, specialists, all that kind of stuff, also has a deductible. It's a smaller deductible. Right now it's about $250 a year, and it is an annual deductible, so it runs January to January. You're going to pay the first $250, and then Medicare is going to pay 80-20. So they're going to pay 80% and you're going to pay 20%. The problem with that is that 20% doesn't have a stop, doesn't have a limit. So if you had a significant medical expense, your 20% could get pretty high. So likely, if you're going to stay with original Medicare, Part A and Part B, you'll likely have a Medicare supplement plan, either a G or an N. There are a couple other choices, but that's likely what you're going to have. And they'll cover most of those out-of-pocket costs. They don't cover the Medicare Part B deductible, but they do cover the Part A deductible. They do cover the 20%, and it just limits your exposure. It just makes things easy, and it's exactly what you would want. But that's what we do. We walk through all that with you. We make sure we find the right one that's right for you, that's best in your zip code, because that makes a big difference as well. And then we just set things up the way they should be from the start. Then we don't have any worries going down the road with our healthcare. So that's going to be your main decision when you come into Medicare is, do you go into Medicare Part C, Medicare Advantage, or do you stay with original Medicare, A, B, likely a Medicare supplement plan? It's a big decision. You need to understand the differences because they are just drastically different. And I certainly have videos, I probably have 10 videos on Medicare Advantage versus Medicare supplement and how they work. Medicare Advantage plan is a private insurance company. It can be an HMO-based plan, it could be a PPO-based plan, but likely will have a network of doctors, network of hospitals. It'll have authorizations, pre-authorizations, referrals, things of that nature, stuff that I don't want to deal with, especially as I get older with my health care. Original Medicare A and B has none of that. With a Medicare supplement plan, it pretty much covers anything that's medically necessary. If your doctor says you need it and you agree, there's no hoops to jump through, and that's exactly the way that I would want things to work. It works fantastic. I say quite often it's almost too good for your health insurance, but let's take it while we got it and do everything we can to hope it stays there as it goes forward. So important to understand those two choices for sure. And then the last facts on when you can change things. So people get this confused all the time also. If you have a Medicare supplement plan, a Plan G, a Plan N, you can change it anytime you want. You don't have to wait for any specific time period or window. So if you have a Plan G, a Plan N, or a Plan F, and maybe you've had some rate increases and your cost has gotten higher over time, you can change to another Plan G or Plan N, usually at a lower price. So it makes a lot of sense to shop at least once a year, but certainly you can do it anytime you want. You don't have to wait for any specific time periods. Now, in most states, to get into another Medicare supplement plan, once you're already in Medicare, you generally have to go through medical underwriting. I mean, you have to get approved. It's just a list of questions on whether or not you qualify for a Medicare supplement plan. It's usually big stuff like cancer or Parkinson's or things like that that would disqualify you from a Medicare supplement plan, but it's really not complicated. And again, that's what we do, is we do all the legwork and make sure that it gets the best avenue to make it happen, because that's what we want, is to get the best value out of our Medicare supplement plan. And then on Medicare Advantage or a Medicare drug plan, it does have timelines and windows. There's what's called Medicare open enrollment at the end of every year. It runs between October 15th to December 7th. You make your choice in that time, goes effect on January 1st. And it gets a crazy time of year because there's so many people that are unhappy with their Medicare Advantage plan. They want to change, they have to change, their doctor left, their hospital's no longer there. It's just a whole different world than Medicare Original. So that is the only time you're kind of locked into that plan for the year if you hadn't made that change. And it can be really, really difficult if you don't have it set up exactly the way it needs to be set up for your situation. So those are some quick facts about Medicare. We help with all this. We'll walk through it with you, and we just try to make it easy. So give our office a call, visit my website, fill out the form. We'll send you a quote on the best Medicare supplement in your zip code, and we'll make things as easy as we can. Have a fantastic day.